Welcome to Beyond Adjustments. I am here with Dr. Justin of Clear Scoliosis in Huntersville, North Carolina. So glad you could join me this morning.
Yeah, thank you for having me.
No, really, I'm excited. I'm looking forward to really getting into um, some topics that not a lot of people know about. Kind of scary for me to even talk about some of it because it's so personal to me. But before we get,
To us
yes,
both.
well, for sure, 100%. I mean, I would hope so. I would hope they would have some skin in the game, right?
Yeah.
Um, but before we kind of get into all that and get into the semantics of it and the details of what our kind of what our topic is for today, which is scoliosis care specifically, we'll get into other topics as well. But I want to talk a little bit about your personal story, Dr. Justin, if that's okay. Um, so your specific journey, right? You had some health challenges that you needed to get over. You have shared that with me in the past. Truly inspiring, honestly. Could you share how that shaped your decision, just as far as specializing in scoliosis care? Would you mind sharing that with me?
Sure. It goes twofold of why I got into chiropractic care and why specifically into scoliosis care. Um, I had seizures for about 30 years of my life, 30 years plus of my life. And so with seizures, you're on all these medications. The medications, most of them are designed to slow your brain down, to make the synapses go slower, right? So that way you don't have
Right.
seizures. And when you're getting into these type of seizures, I was having about 20 a month for years and years.
Oh, goodness.
Yeah,
I didn't even
know,
realize
right?
it was that severe.
So imagine trying to hold a job down or even have a license. You really can't do much. They just take away, they pretty much just take away your life. And the last time the doctor was like, yeah, we're just going to sign you up for disability. Like you're just going to be on disability the rest of your life. And here's Social Security for you. I'm like, well, it's not really good. And so at that time, I already had a degree in nuclear medicine. I already had a degree in healthcare management. I was a former missionary at that point, and I came back. I'm like, well, there has to be a different way.
Right.
There just has to be a different way. And so I saw alternative care. By alternative care, meaning somebody to look at things differently than just here's a potion or here's a pill or here's surgery. And so I sought out who my now wife was seeing. And she is the one with scoliosis, and she had two 45-degree curves, and so at this time, about this time is the doctors told her she had about 6 months until she was going to be permanently hospitalized. Right? She was told she was never going to have children. She was told she'd have a random fever. She'd have a fever at 2 p.m. for no reason. And she had allergies to all kinds of foods, almost everything you could think of. Right? They're like, just sorry, you're dying. We can't tell you why, but you're dying. And so the answer was, sorry, we got nothing for you. And so your and my journey is very similar outside of work. And we looked at our bills and we're like, well, we gave more than 10% to the hospital system. Right?
Yeah.
We gave more to the hospital system than we gave to God. Something's got to give.
Right.
Something's got to give.
Right.
So
Right.
she found a doctor. There's a corrective care doctor. In 6 months, she was off all her medications. And so when you get into scoliosis care, we can talk a little bit more about that. Yeah.
Wow.
But when you get into this type of stuff, this is my fear for young girls and young boys is they have this diagnosis. Well, this diagnosis leads to this diagnosis, which leads to this medication and this medication. And so before you know it, you're on 15 medications, one to counteract the other one, diagnosed with everything from depression to anxiety to X, Y, or Z. And so I found this doctor, and he's like, yeah, you want to try something different? I see what's going on here. One quick look at her x-rays, and it was like, here's what's happening.
Yeah. Yeah.
And then game changing from there.
Wow. Wow. And that, I mean, obviously your kind of story and your seizures and whatnot that you were dealing with kind of said, okay, I need an alternative solution, along with your wife's story, really molded your career in a sense, and how I would say giving back to people that are in your shoes or were in the shoes that you were in. I guess that not just makes it a personal thing for you, but more, it almost feels like, for me, and correct me if I'm wrong, it's almost like you're on a mission now.
Oh, we're on a mission, all
Yeah, yeah,
right.
yeah,
And so, back to my story is I haven't had a seizure or taken a medication over 10 years,
yeah.
right?
Wow.
And obviously, I got two kids at
Wow.
home and
Yes,
no more
yes.
fevers and almost no allergies. And life,
Yeah,
life can change
yeah,
when you allow the body to heal the way it's designed to heal.
yeah,
I'm not telling you solves all problems, but I
yeah,
can tell you more often than not, when you allow the body to heal, it's going to.
yeah. That's crazy. So you made a comment about how the doctors were telling your wife that she wouldn't have kids and all that, and like you just mentioned, you have two children. So I mean that's a miracle in and of itself. So that's amazing. I mean I had similar situation with my firstborn child Emily, who actually is in heaven now. But when she was first born, doctors just told us to put her in hospice and she would eventually expire. That's the experience I have with the medical industry. It's like they treat patients like cartons of milk.
Mm.
Well, she proved them wrong. She came home with us and she lived with us for a year and a half. And God did miracles throughout her life throughout that year and a half as well. So I get the whole medical side of it and how it's almost like box checking. And they just kind of regurgitate what they're being told to do and say. And a lot of it has um, no weight behind it. They just say it to say it because the patients won't understand it. That's how I felt at least.
Yeah. I mean,
Um,
we have the best medical system in the world, hands down,
mm,
in the United States.
yeah.
If you're bit by a shark and you're bleeding all over the place, don't come see me. I don't want
Right.
to see you, right?
Right.
Go to the ER.
Exactly. Yeah.
They are great doctors, but unfortunately, what
Yes.
we've tried to do is take that system of care and apply it to your daughter,
Right.
or apply it to your son, or apply
Right.
it to my wife. It's
Right.
just not how it works.
Yeah. 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 Totally. Well, thank you for sharing your personal story with me. Sometimes we can get in a place of vulnerability, and I appreciate that. I really do, because it really does tell your why and your story and why why you even do what you do.
Yeah, I see lots of things like chiropractic. We don't have the best research.
Yeah,
Right? The same adjustment I give you may change your life,
yeah,
and I may give it to your son. He's like, "Thanks, Dad."
yeah,
That's it.
yeah.
However, nobody, regardless of this or something else, can refute your testimony.
Right, exactly.
Right? And this is why
Yeah,
it's so powerful. Nope, this is who I am. This is what
yeah,
happened.
yeah, yeah. So speaking of my son and my daughter, um, when we walked into your office, I felt intimidated in almost a good way. It's a weird feeling. I can't even explain it, but we were in search of care for them both. I think my audience already knows that both of my kids have scoliosis, one more severe than the other, but we actually tried the medical route and we talked to surgeons and they pretty much just said, we're just going to wait till his curve gets to like 50 degrees and then we'll talk about surgery. That didn't seem like a solution for us. Both my wife and I, we just looked at each other like, something doesn't seem right here. And at that time, he was already actually receiving chiropractic care when they told us it's full-blown scoliosis. And then long story short, found you. So that was life-changing for my kids specifically. Now, not a fun journey because they do say some things about you when you're not around. I'm just saying,
They're not the
but
only ones.
but it's definitely a love-hate relationship. But I mean, I saw with my own two eyes, and this is where I kind of start to choke up a little bit. But excuse me, I saw with my own two eyes what the care that you provide does. My sorry, my son's curve in his intensive treatment improved like 14 degrees or something. That's in a matter of a month. So we went from talking about letting it get worse and possibly doing surgery to improving 14 degrees in a month. I mean, if that's not, I mean, that's nothing short of miraculous in my opinion. So the fact that, God has given you that knowledge, right, and understanding of the body to be able to manipulate and do what you do is absolutely phenomenal. So I just want to actually publicly thank you.
Oh, thank you.
I've thanked you 100 times over, but publicly thank you for the work that you do because it's impacted my family specifically. So thank you
You're
again.
welcome.
Yeah, yeah.
Had some great mentors. My mentor died last month, Dr. Dennis
Oh,
Wogan.
I'm sorry to hear
And
that.
it's okay. A great man, but passed his knowledge down.
Mm. Well, I'll thank him one day. I'll thank him one day. All right. Well, again, thank you for sharing your personal story. Just a question for you. You have a comment, a tagline possibly on your site. I'm not sure if this is what you go by, but you say, "Bend, don't break." Okay. So I don't know again if it's your tagline or whatnot, but honestly, that bend, don't break kind of reflects resilience, in my opinion. So how does that philosophy kind of guide your practice and your patient care? That resilient view, that bend, don't break.
Yeah, it's a good question. Dealing with scoliosis itself, scoliosis is it's a lifelong diagnosis. There's no cure for it.
Yeah.
We can reduce it down 14 degrees, 20 degrees, take you out of surgery, even reduce down curves below quote unquote scoliosis, which is just a name. That's all scoliosis is. Anything above 10 degrees
Yeah.
is classified as scoliosis, right? So you'll essentially have it, quote unquote, have it forever, kind of like alcoholism. Even though you're not drinking, you're still an alcoholic, right?
Sure. Sure.
And so this is going to impact their lives forever and ever, pretty much, until we get our new bodies.
Yeah.
And so there's always that case of the resilience in there of here we're overcomers.
Yeah.
Because it's possible.
Right. Right. That's good stuff. That's
So
good stuff.
it's like if you read a little further on the website, it'd say, you come to the office when everybody says it's impossible. We're gonna work on it and make it happen.
Yeah. Yeah. I love that resilience, man. Like seriously, that's the picture I see, and witnessed actually. Awesome. Awesome. I did notice, congratulations are in order here. I did notice that you were appointed to the board of directors, the Clear Institute board of directors, right? In
Yes.
March of this year?
Yes.
So
early this year.
congratulations.
Thank you.
Yeah,
Thank
that's
you.
that's huge, man.
It is.
That's
It is for
huge.
me. It's a goal of mine.
Yeah, no, that's absolutely amazing. How long have you been part of the Clear Scoliosis network?
I went to chiropractic school to become a clear doctor. So,
Oh, okay. So from the beginning.
it's a postdoctorate program. So how I view the Clear Institute is kind of like neurosurgery of medicine. Like,
Okay.
you can become a general practitioner, but you really have to go on if you want to be really good, right? So you come out of chiropractic school, you have a really good basic notes. Anybody that's gone to school, period, understands the basic bachelor's degree is going to give you just that. It's going to give you what you need to get by.
Sure.
But if you want to be really good, there's lots more training to go with that. And so the
Right.
Clear Institute is why I went to school. So I was taking these classes while I was in grad school at the same time to meet Dr. Bogan, to go through, because they are a corrective care doctors, right? Scoliosis is the most difficult spinal deformity to work with. And if you can work with that, then I figured we can do anything, right? And so
For sure.
I went and sought out Dr. Wogan. So how I actually started this was the chiropractor we were seeing was helping out me and my wife. And so I went and found his mentor and said, what are you doing? Because
Yeah.
this is different.
Yeah.
It's not standard chiropractic.
Yeah.
This was making massive changes in everybody's lives. Not just here's an adjustment, I felt really good. This was making long-term changes.
Yeah. Yeah. That's good, man. So how do you feel like that this new role enhances your practice, maybe contributes to advancement in scoliosis care?
CLEAR is an acronym.
Yeah.
So the R stands for research. And so the new role just helps me be seen more, public eye, also helps me in the decisions. CLEAR is a 501c3.
Right.
And so each one of us doctors are doing research. This just helps get me into, okay, what are all these guys doing for their research and how can we add to that?
Got it. All right. Well, here's $1 million question for you. If you had the opportunity to share one key lesson from your journey with every aspiring chiropractor, what would it be?
Always get better.
Always get better. Short, powerful.
Don't never stop.
Love it. Yeah, I guess because when you're stagnant, right, you're actually going backwards. You're not staying still, in my opinion.
Yeah. I mean, chiropractors are renowned for not staying in the field very long. Um, they're taught X, Y, and Z, and many of them don't stay in the field. It's a very difficult field to stay in. It's a very difficult business to stay in,
Yeah.
as we'll talk about in a little bit later. I have a niche. I'm one of 21 doctors in the world that do what I do. My patients mostly come to me. And so, but the standard chiropractor at the joints or at the next chop shop down the street, I mean, it's monotonous, same thing over and over and over.
Yeah.
But if you get better and continue to get better, I mean, we're changing lives. I see the miracles happen in our office, right? Consistently, not just, hey, I had this story one time.
Yeah.
No, these are my expectations.
Wow.
If that's not happening, something else is wrong.
Right.
Always getting better.
Always getting better. Always get better. Always do better. I love it. I think though that even that shouldn't just apply to chiropractors, really. That should just apply to us personally, professionally, in our professional lives. I love it. That's good.
And I spent $20K in education this year.
Wow.
Like, I'm going to be better. I'm going to learn from the best.
Good for you, man. I love it. Good stuff. All right. Let's get into the science of it all. This is going to be fun. All right.
Dr. Justin's a super geek.
All right. I love super geeks. I learn from them. No, I love super geeks. It's awesome. So this is the part where I'm going to end up probably asking you to either repeat something or, hey, I didn't understand that quite well. If you could just kind of elaborate a little more. So, all right. So let's talk a little bit about understanding scoliosis. So scoliosis, at least for me and from the people I've spoken to about it, the layman we'll call it, right? It's misunderstood. So could you explain what it is and why early detection and treatment are critical?
This is a great question. So scoliosis, as a whole, nobody knows what it is.
Yeah.
As a whole, right?
Yeah.
It's measured by a side curvature on an X-ray that comes from front to back or back to front. Every doctor in the world knows that it's bad news. Every doctor knows how to measure it, but that's all you're ever taught. Right? Some of the new surgeries, some of the new stuff that's coming in, some of the stuff that I'm doing, we're starting to pinpoint more of, okay, here's the biomechanics of it, and here's what's going on.
Yeah.
So my mentor, Dr. Logan, who was a biomechanics teacher, and so if it got there, his objective was, well, why can't we reverse engineer it? Right? So when we're looking at scoliosis itself, we'll look at the spine in 3 dimensions, not just from the front, not just how we measure it. This is a side effect of actually what's happening. So when we're looking at scoliosis, from the side, the most important x-rays from the side, we want a good curve in our neck, a good curve where our ribs are, and a good curve in our low back. Right? 100% of scoliosis cases don't have that. Right? So when the spine moves, almost always the spine, each individual vertebra comes backwards and it rotates. Comes backwards and it rotates. And here's where I have issues with chiropractors. They adjust this one bone, but when they adjust one bone, they're moving essentially multiple at a time. So imagine taking your spine, that you have these good curves here, and these good curves start to go away. It's not like you just grow up and out. Actually, what happens is if you take your spine and you lose the good curves, it starts to rotate and rotate and rotate and rotate. Eventually, it creates so much torsion that it comes out to the side. And that's what scoliosis is so far.
Can you explain torsion?
Torsion. Imagine taking a rubber band and stretching it and turning it and turning it and turning it and turning it. It creates so much tension in there that it has to have somewhere to go. So the rubber band will come out to the side and come back up. So it's a rotation. So if you have a diagnosis of scoliosis and the doctor says, oh my goodness, you have so much rotation in there, you'd be like, well, you can't have scoliosis without it. By definition, scoliosis is rotation.
Gotcha.
So it's somebody that doesn't understand it very well. I'd seek care somewhere else.
Well, let me ask you this. So my plain understanding of scoliosis is that it's shaped like an S. Is that always the case?
No.
Or okay. Can you explain that a little?
There's many different types. Scoliosis is just a measurement of 10 degrees, a Cobb angle. That's how it's measured.
Okay.
So you take the curve, and you take the most tilted at the top and most tilted at the bottom and measure them together, and that's what they call the Cobb angle. And
Cobb
so as
angle,
long
you
as
said.
that Cobb angle could be anywhere in the body, it could be 1, could be 5, could be 6. They're just measuring the Cobb angles in there. So the curves from the front or from the back to the front, as long as there's something over 10 degrees, and it's classified as scoliosis. Now, I want to kind of get this right without being too nasty. Scoliosis is just a number. If you're married to that number and you're married to that diagnosis, nobody can help you. It's just a name. It doesn't mean anything.
Wow.
Right? So I use a kind of a crude analogy. I mean, if you have stage 4 cancer, right, which is a death sentence many times,
Sure.
but you live a full life and you have a joyous life and it doesn't bother you, then who cares? Who cares? Right? So scoliosis is a name given to anything over 10 degrees, right? But it doesn't define who you are. You can live a full life if you treat it appropriately.
That's so good. Don't almost label or identify yourself as it. You have it. It's being treated.
That's
But
where
live
it ends.
life despite of it.
But that's where it ends. It doesn't define you.
Right. That's good. Wow, that's good. Thank you for that. All right. I want to talk a little bit about, so I read, all right, this is controversial in my head. I read on Clear's site that they emphasize non-invasive care, which I get. I get why they call it non-invasive.
Oh, here we go.
So I've been adjusted by you, so that's a little contradictory in my head. No, it is non-invasive. I get that, but it's very. I'm trying to use a good, nice word
aggressive.
here. That's a good word. We'll go with aggressive. But so how does that differ from traditional approaches like we'll call it surgery even, certain types of bracing like outside of the chiropractic world? How does that differ? Like the non-invasive care.
Good question. So non-invasive versus invasive. In the medical models, which are the question you're actually getting at. So in a medical model, invasive is surgery, right? Or any variation of that. And many times, specifically when you start getting into 40, 50 degree curves and they want to do surgery, surgery doesn't end there. You're almost always going to have another surgery and another surgery. It's just the beginning of a disaster. The spine's meant to move. And what surgery does is it stops it from moving. So then it has accelerated degeneration. Right? So it's just a matter of time before you have your other surgery.
Sure.
But so what we're getting into, the discussion we're having is it invasive, meaning are we doing surgery? No, we're not doing surgery. Is it fun? Not always.
Not ever.
No, not ever. Care in our office is pretty boring as a whole. The adjustments are very aggressive. I'm going to make changes. While you're on my table for 2 minutes, I'm not there to be your friend, right? There are certain adjustments that are better than others, but for 2 minutes, it is what it is, and then you can move on, and the pain or the soreness or whatever you have kind of goes away immediately afterwards. But we're going to make massive changes really quickly.
Right.
Hence, we can take 14 degrees off your scoliosis in 10 days.
Yeah.
Right? We make massive changes quickly.
Yeah.
And most of our patients are not local, so if we make those massive changes, we send them on.
Right.
So invasive, more of a surgery route. Non-invasive is pretty much anything outside of that. So adjustments or bracing, those are classified as non-invasives, even though they are aggressive. And you'll probably attest to I'm probably the most aggressive adjustment you've had. And I'm probably the most aggressive anywhere close to us as far as state-wise.
Yeah. Now, I know the answer to this, but I'm going to ask it anyway. Do you still recommend bracing, or do you recommend bracing, and what type of bracing in certain cases or in all cases for your scoliosis patients?
When you're getting into scoliosis, we need to start classifying the risk of progression, right? So you and me, we're done growing, if we have scoliosis and we'll just say it's at 15 degrees, it's pretty much going to stay stable for the most part. Unless something happens, it's going to be stable. Versus if we have a young kid that has still a ton of growing yet to do, and we can get into the science of that, but we'll just say they have a ton of growing yet to do, and they have a relatively progressive scoliosis, meaning it's going to be 20, 30 plus degrees. That's going to require more action, more aggression. So while we could do the Clear Institute cares, we could take 10, 15 degrees, 20 degrees off your scoliosis, however the body reacts. The brace is going to be like taking me home every day. And so it's going to be more aggressive. Now, historically, braces don't work. Right? This is why my mentor didn't like them. Historically, they don't work. They, at best, stabilize things.
Right.
Because they're created in a two-dimensional form. The brace that I use in the office, it took me years to get involved and years for them to prove to me it worked.
Right.
It works pretty well.
Yeah.
As you can attest, it works
that
pretty well. As
firsthand.
long as we're
Yep.
using it, it works. It works in 3 dimensions, like scoliosis is a 3-dimensional diagnosis. So that's where we get into kind of more of a bracing. We want to use those with the aggressive scoliosis, right?
So if somebody comes in and they're at a 15-degree curve and we'll call them 14 years old, they obviously have some growing to do. Would you recommend a brace in that situation?
Probably not.
Okay.
Probably not, right? Because at 14 years old, whether you're male or female, you're almost done growing based on their x-rays. You can look at their wrists or you can look at their hips, depending on which kind of doctor you are. But they're getting close to being done, and 15 degrees really isn't that bad in the scheme of things. If we get into the math, it's not really that bad.
Right.
When you start getting above 30 degrees, then you're like, oh, okay, we need to really do something about this soon.
Yeah.
And there's some different doctors, even clear doctors, that will kind of dispute what I'm saying right now. But as a whole, we'll all agree that it's not very likely for it to progress. But there's more doctors that will say, hey, let's just throw everything at it, even if it's 15 degrees, and take it down to 2. And then when you're done growing, it's relatively stable at 2 degrees.
Gotcha. Okay. Awesome. Okay, I want to talk. So I was reading a little bit about your certifications, and I didn't quite understand all of it. So in my mind, these are like advanced certifications, right? So you've done your schooling and whatnot, and then these are like on top of everything. So I read something about World Masters, ISICO, and obviously the Clear Intensive Care. And in my head, these kind of set you apart from all the other doctors I've spoken to or I've dealt with. How do these certifications, or do these certifications in some way enhance your patient care? Is that fair to say?
Yeah. I mean, back to me being a super geek. Yeah. You can learn something from everybody, even if it was a bad experience.
Yeah.
All right. And so the ISICO is out of Milan, Italy. And they are the physical therapists, the masters of physical therapy, essentially. And so I took their classes, learned a lot from them on physical therapy, and then the bracing, and I just finished up with CBP classes, which was 70 hours of lecture. It will just never end, specifically in scoliosis, since nobody knows a whole lot about it. In the big scheme of things, nobody knows a whole lot about it. In our world, in the first world nation, there's not a whole lot of money to be made with it, so there's not a whole lot of research in it.
Yeah, I understand that.
And so we're learning, always going to learn and continue learning and presenting more stuff. Now, we did present at the SRS, and so some of the international stuff recently with some of our results. Some of the difficulties when we start presenting international is people don't believe the results. Even though they're reproducible, you saw them firsthand.
Yeah.
Like, what do you mean you can't take 18 degrees off of scoliosis? These aren't the same x-rays. Okay, I can do this all day long.
Yeah.
But this is why it's so important for us to continue to research and continue taking these classes and continue to learning from these people and doing more stuff. Because these give us more credibility. Hey, I took that class. I understand exactly what you're doing. Right? I took your physical therapy classes. I know exactly what you're doing and what you're really good at and what you're missing. And we're integrating those into what we do to help. So I'm kind of like a hybrid of a chiropractor and a physical therapist, right? Chiropractic is hands down should be the number one spot for scoliosis. It is a spine problem. I don't care what anybody says. They can't prove it to me wrong.
Right.
Right. So
Right.
everybody's going to disagree with that. I don't really care.
Yeah.
When the spine moves out of place, you have to be able to move the spine back, not just build muscles.
Sure.
But you have to move the spine and build muscles. And so this is what gets into all these extra classes. Okay, who's doing it best? Let's go learn from them. Who's doing this best? Let's go learn from them. Again, be at your best. Always never stop learning.
Yeah. Never stop. That's awesome. I got the $1 million question for you. You
Ooh,
ready?
Game on.
All right. So if you were given unlimited resources to transform scoliosis education as a whole or treatment, okay? Unlimited resource. I'm not saying I'm going to give you like $1 million. Like it's literally bottomless. What would be your first priority?
With scoliosis. Well, I'm doing some research in my office right now, which I think is going to be able to help masses. And so that's probably where I'd go. I'd work on finishing up my research. That's so that way every chiropractor, whether they were good or bad, could have some results. That's where I'm heading right now.
Now, is that something you can get into in detail, or you don't want to talk about it right now?
I spoke with an attorney yesterday about patenting.
Okay.
So probably not exactly
We'll keep
at
it
the
off the
moment.
table. Good deal. Good deal. Well, I
But
hope
our goal is to, even the chiropractor down the streets, even if he has no idea what he's doing, he's still going to get some results and maybe help out your son or daughter. And if he's not getting the results, then you could come see me. Right? It's not about me. This has nothing to do with me. Right? It's your patient is your number one.
Yeah.
Right? If we could help that out before it gets to be a problem. Hey, we have 15-degree curves and we're only 8 years old. Here, use this tool. Maybe it will help solve all that. It doesn't cost very much money. Maybe you don't have to come see me. Maybe you don't have to go down the route you did.
Interesting. That's a good answer. I like that. So you said patient is number one. That takes us kind of into like the next section where I want to talk about the patient. I want to talk about patient care, maybe success stories. So you also made a comment earlier about, actually I don't know if that was pre-recording or during our recording, but you mentioned something about tailored treatments, right? Every patient is different. So what does a typical treatment plan look like for scoliosis patients, right? How do you ensure it's, good word I guess would be customized to an individual's needs?
Gotcha. Great question. So as a whole, we work in a very basic setup. Everybody's going to get what we call a mix, fix, and set. That's how what I do is designed to do. Now it's going to be particular for you versus the next person, right? So if you warm the body up and you get all the muscles to relax, you get the body to kind of calm down, we can move it closer to where it should be. Now, once we move everything closer to where it should be, then we have to retrain the body. Hey, you need to stay here. That's where chiropractic as a whole has a deficiency, right? So if they just move everything where it should be, if you don't get to stay there, the body kicks the adjustments back out within 15 minutes. It doesn't work.
15 minutes.
The body has natural reactions.
Wow.
Right? So this is why it's so important. Even if we're short on time, I want you to do at least X, Y, and Z, because otherwise you wasted your time. All chiropractic works. Everybody has their miracle stories. We're just looking for longer term results, right? I don't want you to just see today because you were blind yesterday. I want you to see for the rest of your life. Right? And so we work in a mix, fix, and set, meaning warm the body up, move it closer where it should be, and get it to stay. And we work in that process, but how does that process apply to you?
Right.
Right? With 34 vertebrae in the spine, right? 34 vertebrae as a whole, some of them will be fused together and whatnot, but 34 permutations, math term, 34 to the 34th power equals you're not like the next person. I'll never see another one of you again.
Yeah.
The body can react very similar to the next person. If I see this pattern in there, I have an idea it's going to look like this, but you're different than everybody else. We have to treat that difference. And that gets into the spinal biodynamics, how the spine moves, what spinal injuries are, and that gets into a whole nother conversation. The spinal injuries are, nobody understands them that I know
Sure.
of. Very few people understand them.
Sure.
If you don't understand spinal injuries, you'll never work with scoliosis.
And if I remember correctly, part of our, I guess, intake process, we had to answer those kind of questions of, what kind of injuries have you had? Car accidents, whatever. Did you fall on your head as a kid?
Yeah.
Like whatever, like things like that.
They're there, I promise. And most of the patients, almost all the patients, they're there. It's just a matter of, do you remember them? How long ago was it? And then I'll go find them. I promise you I'm going to find them. It's
Yeah.
just a matter of where.
Yeah, yeah. Awesome. All right. Putting my kids aside, okay, can you share a specific case with your scoliosis care that had maybe a life-changing impact on a patient? Again, we it's personal to me, and I'll answer my side real fast. Our future looks different. It was really doom and gloom for a while. Now, we're not peaches and berries right now because it's a daily fight to get them to wear their braces and all that stuff. But the impact that it had on obviously my kids' lives medically, and then my life as a father and my wife as a mother, is huge. It literally changed the trajectory of our lives and what would be, right, in the future. So, but that aside, that's my personal story. That aside, can you share another one with me?
I mean, another personal story is my wife, right? These are consistencies I see in there, right? And so right now we're talking about a younger generation, but I have many people in the last couple of years, specifically COVID on, where people had a lot more time. And we're getting into the baby boomer stage where they're starting to get older and quality of life is more important for them. And so I've seen many patients over the last few years where their scoliosis is degenerating really fast because scoliosis is a degenerative diagnosis. And all they want to do is be able to golf or get out of bed.
Yeah.
Right? They just want to be able to function through their
Yeah.
day.
Yeah.
And their body's degenerating so fast because they're in a generation where they were taught never to question a doctor.
Yeah.
Right? And so coming in, we can give them their life back, essentially. We can give them a quality of life. Right? So we can change their scoliosis, and there's limitations that matter with that once you start getting in your 60s and 70s and stuff. But we can give them a quality of life. I just had a patient tell me, like, I feel like I have my life back. Like,
Yeah.
oh, look, I can function. I can go golfing again.
Yeah.
I can work my farm. Right? Can you imagine having a 100-acre farm with cows, not being able to farm it? I mean, this
Wow.
patient specifically is in their 70s,
Right.
and they can go out and farm again.
Wow.
They don't have to rely on everybody.
Wow. That's huge, actually. 70s. You would think at, 65, 70, that's it. You just got to deal with what you got. So, wow, that's powerful.
Game changing. I have
Yeah.
a lot of ex-military scoliosis coming in, like
Yeah.
military VA just says I'm disabled. Okay, I wrote a paper when I was in college about this. So it doesn't necessarily have to be like that.
Right.
Right? We can help you out.
Yeah.
And so I see lots of miracle stories like that. Lots of people say, I just thought it was the way it was.
Yeah.
Generally,
Yeah.
people that come into my office like this, I am their last ditch.
Yeah.
If this doesn't work, I'm just going to stay like this. And it doesn't have to be like that.
Yeah.
More often than not, meaning like 99% of the cases, that's not true. That's a mindset. And the mindset is, we're going to talk a little bit more about this, I think. The mindset is number one. Again, if you're married to your diagnosis, I can't help you. Nobody can help you. Right? If you want help, there is help. Almost always. We can help you. Even if it's not reducing down your scoliosis, it's functioning and quality of life.
Yeah.
That mindset is huge.
Can you delve into that just a little bit more, the mindset piece?
Gotcha. Yeah, great. Great question. Mindsets. American culture, we are a very medical mindset. We are specifically, we just went through COVID, right? COVID. Everybody stay 6 feet away, stay in your house, stay in this, stay in
Yeah.
that.
Yeah.
I've traveled the world, right? I've lived in Haiti,
Sure.
traveled to Africa. The doctors, when I came back, I'm like, what happens if I get sick? They're like, we don't know. You've been so many places, we have no idea. We're just going to have to throw everything at you, right? So my body has been exposed to umpteen things,
Sure.
right? And so what people don't understand is everybody's seen these different diagnoses. We have certain bacteria in our body that will kill you. It'll kill you today.
Yeah.
It kills people every day.
Yeah.
But why are you not dying,
Right.
right?
Right.
You have one of the studies I saw, 100 cells of cancer in your body. Right now, you do.
Wow.
But your body kills it every day, right? The mindset of, look, my body can heal. My body's designed to recognize foreign invaders, and it keeps a record of it,
Right.
and it will heal. So I didn't close down during COVID. Nope. Did I get sick? Yep, I got sick. Did my family get sick? Yep, they got sick. You know what happened? They beat it. They beat it, and we got healthier because of that. I'm not that worried about it. Our mindset is, oh my goodness, we're scared of this virus, or we're scared of this, or we're scared of that. The body's designed to heal.
Wow. That's powerful. You just said something that kind of sparked some interest in my mind of the body keeps record of it. We had a conversation a few weeks ago. We were actually, I don't know how we got into this, but we were talking about weight loss, which is also another experience of mine. Actually, once I was introduced to chiropractic care, my mindset changed a bit when it came to weight loss, and I've actually lost over 100 pounds myself.
Congratulations. This is a
Thank you.
big deal.
Thank you, sir.
It's life-changing.
It extremely, extreme. I was close to probably 325-ish pounds. So that can give you an idea of where I'm at now. Don't record that. I'm getting better. I'm getting better. But you said it keeps record of it, right? Is that everything? Like I was once 100 pounds over the weight I am today. What does that mean? It keeps record of it.
In this instance, your body will have the same number of fat cells. So as you continue to gain weight, it will build more fat cells to accommodate that, right? We'll just say we lose 100 pounds just for talking's sake. So you lost the weight. All your body did was it filled up more fat cells. It didn't get rid of your cells. It dropped everything out of your fat cells. The last studies I saw anyways, you just dropped the fat cells of all the stuff in them. You didn't actually lose the cells. So even if you have liposuction, I've been taught is it still builds those fat cells back up.
Wow.
It decides whether you fill them or not. So the body keeps a score. It's a great book for anybody that wants to learn more about like your body learning its history, right? So I am 100% confident, and nobody can prove me wrong, that your body will keep the traumas in your body. Whatever trauma it is. I don't know if it's childhood trauma, car trauma.
Yeah.
It keeps the trauma unless you deal with it, right? So that's a whole nother kind of discussion on how it's keeping the score, but it definitely keeps the score in there. And then if you get into like the immune system, your immune system has essentially a memory. It has different cells in there that says, hey, you were exposed to this bacteria. We built an immunity to this bacteria. If it ever comes back, we're already ready to go. And so the body has many different mechanisms,
That's so
feedback
cool.
mechanisms like that.
Yeah, that's really awesome.
That's why it's let your kids go outside and play in the dirt. You can't save them, right? Let them go play in the dirt. Let them build their immune system.
Yeah.
If you try and hide it from, we'll not talk about vaccines, but you try to give them all these vaccines, you're just ruining their lives. I mean, I don't want to get into medicine, but if you're trying to create a healthy human being, you let them get sick. Let them build an immune system rather than creating a child that's dependent on medicine.
Right. Yeah, we're big on taking as much of a natural kind of approach as possible in our home. We don't do a lot of medications, but yeah, I get that. I get that totally. That's personal to me. All right, question for you. I'm a parent, right? And I've walked through this, and you've given me advice. But to the folks that you haven't spoken to just yet, what advice would you give parents kind of navigating a scoliosis diagnosis for their child?
Gotcha. Research.
Research.
Research everything.
Yeah.
Everything. I'm a big informed consent person.
Right.
Right? If you don't do your own research, then you're only getting one person's opinion. Right? Even if it's medical consensus on things. Medical consensus with your family was, we're just going to wait until we do surgery. But you did some research, right? There are alternatives. As long as we're informed on our decisions, I don't think you as a parent can make a bad decision. I might not agree with it, but I don't think you can make a bad decision what's right for your family. But you have to be informed and well researched on that decision.
Yeah.
So research, research, research. Even if you have scoliosis and you're navigating that, I'd be happy to talk to you. Clear doctors are very open. We're relatively easy to get to. Even just to have a discussion or a couple emails pointing you in the right direction. Even if you're not coming to see us, a big thing is here's the information.
Yeah.
How can we help you? If you want to come see us, great. If not, that's fine too. But research.
$1 million question. And we probably touched on this a little bit before, but what single change? So we talked about unlimited resources, okay? Now, what single change would you make in scoliosis care to improve outcomes for every patient, regardless of the resources? One change that you would make in scoliosis care.
In my office, or overall chiropractic, overall medicine?
Yes.
Okay.
The one that would make the most impact.
All right. Well, I'm doing some research right now in the office. And this is going to be controversial in my worlds, in the scoliosis worlds, of spinal injuries. And so if you do surgery, if you do my care, if you do PT, it doesn't matter. I find spinal injuries in almost every scoliosis patient. And so in my opinion, if I'm a spinal expert, I have a $250,000 education, I'm a spinal expert. But you're never taught what spinal injuries are. So if you're never taught what spinal injuries are you actually really helping the spine? Are you really helping the patient? If we're just kicking the can down the road and you feel good today because I did X, Y, or Z, but it creates an accelerated degeneration, all you're doing is making them worse later. Or if you don't find any spinal injuries and we're treating the spine, but there's an injury there, it's like taking a knife into a wound. You're just going to make it worse. So in my opinion, we have to be aware and understand the spinal injuries and be able to rehab them to effectively treat the spine. And that's something no doctor has formal training in.
Spinal injuries.
I'm a spine specialist, and we don't have any formal training in spinal injuries. You're taught that's bad, but not how it got there, not what to do with it, not how to treat it, not how to measure it, right? I'm a math person, a science person, right? We want quantitative data.
Right.
And so I take my quantitative data and I apply it to best practice. So the standards that I use are AMA standards and best practice standards. So you can come into my office and look at your x-rays and they're quantifiable and they are indisputable. If we go to court, nope, this is indisputable evidence. This is what's happening.
Wow.
But nobody's ever taught this stuff.
Interesting. That's kind of
scary.
Yeah. Wow. Well, I look forward to the outcome of that research.
Yeah. I'm working on taking a larger scale population and putting it together. The bigger the population, the better the research, essentially.
Sampling,
so
for sure.
I'm working on it, but we have to be very careful with it. Just because it is coming from the chiropractor's office, is coming from an alternative source. I wanted to get it published in there's essentially 4 levels of journals in medicine. The top 2 levels are, you better pay attention to these. The bottom 2 are, well, we did this case study and this, you felt better, right? So they're nice, but if you're in the top 2 levels, you better pay attention.
Sure. Very cool, man. All right. Now we get into my favorite topic.
All right, let's go.
This is the fun part for me. We're going to talk a little bit about the marketing aspect and growing your practice, if you're good with it. So you're, in my eyes at least, even in the eyes of people I've spoken to in your office, your clinic has really become a leader in scoliosis care in the Charlotte area. So, what strategies, if any, have been kind of most effective in bringing in patients through your door?
Gotcha. Great question. And we are probably 50% referral,
Wow.
right? Get really good at what we do. I'm not saying you like me, right? You don't have to like me, which is fine.
That's irrelevant.
Most of my patients do, but for a couple seconds they're not going to. But results based. I have one negative review on my website, Google review,
Really?
and he's kind of abrasive with his adjustments, and it was a person that was, I understand who they were. They're introverts. He's kind of abrasive, but he gets results.
Oh, and that was the negative. Oh, okay.
And so it was an introverted person. This person was a very sweet person.
Yeah.
And I completely understand where they were coming from, and they're probably right for that person.
Yeah. Yeah.
But we got results,
Yeah.
and it was life changing for this person, individual. And so it was if we get results, I can kind of do anything for a short amount of time for
Yeah.
results. And so we do. It's highly referral based program because we're going to get results when people said they've tried chiropractic, they've tried PT, they've tried the injections. Well, back to they haven't tried actually getting to a root cause.
That's good. So you said 50% referrals.
Probably at least 50%, yeah.
Okay. What about the other 50%?
The Clinical Institute's a 501c3. Probably 50% of the people find me through that.
I see. I think that's how I found you, actually.
Yeah.
Actually, there's a Dr. Tony, right, in Florida.
Yeah, Dr. Tony Naldo, wonderful man, great doctor. He runs a great practice. He's one of our lead researchers. He's the chairman of the board.
Yeah.
Great doctor. Highly recommend reaching out to him,
Yeah.
specifically if you're down in Florida.
Yeah, we were going to go, actually. We were going to go see him. I called their office. I set time. We had a meeting with him. They told me where we could stay when I take my son and all that. And then we're like, wait, we don't want to be that far away from home, our daughter, and things like that. So my wife was like, let me just look and see. Let me see what we can find out. So she did, and that's how we ended up finding you. So so Dr. Tony came as a recommendation from my son's chiropractor here in Fort Mill, and then, and that's how I found Clear, and then through Clear we found you. So
yeah. So I haven't. So to answer your question, I haven't really pushed a whole lot into marketing.
I think that has a lot to do with your specialty, right?
Yeah, it's a difficult niche to get into, right? Being a scoliosis specialty, because almost all scoliosis is classified as idiopathic, and at most, I've seen a book say scoliosis is 8% of the population, right? I think it's probably closer to like 20 because not everybody gets X-rays, right? So generally, it's found at age 12. Historically, age 12 during a physical, it was just what happened, and it was there. And then the first call is what can you do? But it's a niche market because it's such a small population compared to the number 1, 4, and 6 reason for chronic pain and disability in the United States has to do with the spine.
Right. Right.
Neck pain, headaches, and low back pain. Everybody around has that compared to scoliosis.
So you said 8% ish, right, of the population, closer to 20 because people don't. I believe that. Because we were on vacation. We were actually on a cruise headed back to the boat. We were in this line, and there was this gentleman standing in front of us, and my wife noticed his back. Obviously we're dealing with what we're dealing with, so these things kind of pop into our head. So
welcome to my world.
Yeah. so she saw his back, and she goes, "This guy definitely has scoliosis." Like just kind of seeing his curve, and then I'm like, "Yeah." She's like, "I should say something." I'm like, please don't say anything. She's like, "No, what if he doesn't know? He needs to get help." I was like, "Okay." And she taps him, and she's like, "Do you have back pain? Like, are you in pain? Like, or whatever?" She's like, "I think you have scoliosis." He's like, "Yeah, I have." He's like, "I have a lot of back pain." She's like, "Have you ever seen a chiropractor?" And his friend was like, "This guy's always in pain," and it became this huge conversation. But like, this guy was probably in his mid-20s, maybe 30, and obviously undiagnosed. So I believe that gap exists. You said 8%? No, yeah, I would say more like 20%. Yeah,
Yeah.
definitely
And,
accurate.
and seeing a chiropractor on that note, there are a difference between chiropractors who treat scoliosis
Mm-hmm.
and doctors who specialize in scoliosis. Right? The wrong adjustments for your family is actually going to make things worse
Mm-hmm.
for both your kids.
Mm-hmm.
Um, we have to be very careful that we're doing what's right
Mm-hmm.
for the patients. And so you're not qualified to treat scoliosis. I had a consult this morning with somebody from Michigan, a chiropractor, and this chiropractor just took an office over in this last year. And so they took an x-ray yesterday. So they called me today. They're like, hey, this person has a 68-degree curve, and she's been getting adjusted here for 7 years. What can we do? I'm like, well, you should have sent her to me 4 years, 5 years ago. That's what
Yeah.
should have happened. So in my eyes, whether you're a medical doctor or you're a chiropractor or a PT, it's borderline malpractice in my eyes.
Sure.
Like, you're not qualified to deal with this. You have to do something else.
Yeah.
And so,
Wow.
seeing it is one thing, but part of my qualifications are, if you don't know how to treat it, can't treat it, you have to be able to send out a referral. North Carolina, we're portal of entry doctors, right? So it means if I find something wrong, period,
Yeah.
we're responsible for it.
Wow. Malpractice. That's a strong word, but
It
yeah,
is.
I guess.
It peeves me that much.
Wow. Interesting. Okay. Wow. All right. Question: How would you educate potential patients about chiropractic options for scoliosis? Kind of while. So, and the reason why I ask it that way is because in my eyes, you're an expert. Okay, you're an expert in this field. You can talk about this up, down, sideways with your eyes closed and hands tied behind your back. But how would you educate a potential patient about chiropractic options for scoliosis?
Gotcha.
And to kind of frame the question more from I hate to put it this way, but really marketing perspective. And what I mean is um, teaching and educating in a way where it will bring more patients that have those issues in to see you. Does that
Gotcha.
make sense?
So a big piece of, I think what we're talking about is the education piece of that, is of what scoliosis is and what it's not.
Yeah.
Scoliosis is a three-dimensional curvature of the spine, right? It's an abnormal biomechanics.
Mm-hmm.
So when we're getting into that, as you mentioned, your wife's like, hey, do you have back pain?
Yeah.
Right? Uh, Pain is I think at most I've ever seen literature says pain is 30% of your nervous system.
Mm-hmm.
Right? You don't tell your eyes to blink, you don't tell your heart to beat, you're shaking your head, you're not even thinking about this stuff.
Right.
Almost everything you do every day is autonomic. It does it by itself.
Right.
Right? It's really scary to see how much we actually think about and we do
Sure.
all day.
Yeah.
Right? And so by the time pain comes in, something's wrong.
Yeah.
Right? By the time you feel a broken bone, by the time you feel a heart attack, by the
Yeah.
time you feel stage 4 cancer,
Yeah.
something's wrong. By the time something happens, symptom shows up, something's wrong. Right? So if the brain sits up top and sends signals all the way down through it, every level these nerves come out, they go to every organ and tissue in your body, they control
Sure.
everything.
Sure.
Right? So you might not feel pain, but we might have lung problems, we might have allergies, we might have migraines, we might have breathing problems, you might have digestive problems, you might have not be able to have children, you might have sexual problems. I mean, you might
Sure.
have post-concussion syndrome,
Sure.
eye problems, hearing problems, you name it, right? The nervous system controls absolutely everything. So when we're getting into this, how is this used as marketing? It's not about pain. Scoliosis care, chiropractic care as a whole is not about pain.
Mm.
We're getting it all wrong. And back to that mindset.
Yeah.
Do we want to be healthy or do we want to be retroactive?
Mm.
Medicine is retroactive. We have a problem, let's fix it. Nope, we want to be proactive. We want to get to root causes so that way we don't have a problem.
Mm. That's actually a
And
great
so
answer. Yeah.
It's you have these symptoms. Okay, well, a lot of these things, might not necessarily be back pain, but I've seen the blind see. I've had the deaf hear. People are told they're never going to walk in, pick up, and walk out of the office. Right? This is okay. There's more to it than just back pain. Have you looked at this?
Yeah. Yeah. For me personally, I'm actually believing for a miracle for my hearing. because I believe that if I get back in alignment, specifically around my atlas area, that I'm going to get my hearing back. I lost hearing in my right ear about five-ish years ago. I woke up one day with zero hearing. Literally, it was ridiculous. So yeah, and actually, it was you that I spoke to that first kind of gave me hope of, hey, this could be the cause. And then I spoke to another doctor, actually Dr. Juan, who is the one that I interviewed prior to you. We now see him weekly because he's closer. Which, by the way, you need to move your office to Fort Mill because Dr.
Yeah,
Juan
yeah.
is moving on as well. So you need to come so we can start seeing you. But yeah, that you're right. It's not always pain. It could be anything.
Yeah, and specifically when you get into this, if nobody can find a reason, right? Well, then this is where I'm going with this,
Sure.
right? If you have a tumor, you go see somebody else, right?
Yeah.
If you have all these seizures, in our office we have about an 80% chance of getting rid of seizures or limiting seizures, right?
Mm.
But if you don't, if everybody else has cleared you, well, then we're going to look to the spine.
Interesting. Okay. All right. Talk a little bit about balancing specialties. Okay. Because personal injury and general chiropractic are part of your services as well. So how do you market those alongside your scoliosis specialty, or do you?
Marketing personal injury. That's a good question for you.
Yeah.
This is why we're talking.
I got a pride. Yeah.
This is difficult. This is a difficult field to get into. And mainly for me, I got into personal injury because I'm tired of seeing patients 15 years after a car accident have degeneration, have all these issues that should have been dealt with on day one.
Yeah.
Because even if they did see a chiropractor or a physical therapist or medical doctor, they don't understand spinal injuries.
Right.
And so if you don't understand spinal injuries, then I'm just picking up pieces later. So I got into it to deal with the patients on day one. All right. So I got into it for best practice reasons.
Yeah.
It does pay. It's a lot more difficult to work in. The marketing itself is way more difficult.
Sure.
As I'm sure you're aware.
Mm-hmm.
And so I do a lot of teaching in this world. Lots of lectures. Lecturing doctors, lecturing attorneys, lecturing patients, lots of here's what we're looking for. 55% of car accident victims don't recover. That's I think it's a 20-year study, 15-year study.
Wow.
Right? So it's a big population.
Yeah.
55% don't recover.
Wow.
Well, why aren't you recovering? Why not? It's a good question.
Yeah.
So we'll just say we're in South Carolina now. But if you're in a car accident and you're not recovering, nobody is actually winning in this, right? So you're not getting better. The attorney can't do his job. The insurance company doesn't want to pay out a ton of money because you're not getting any better. That's what insurance is for, right? But nobody's actually getting things settled because you're still injured.
Wow.
Or they'll rush it through really quick to get you some money, but now you still have an ailment long term that's impacting your quality of life.
Gotcha.
So the marketing, lots of education again.
Education. Okay, that's good. So in today's kind of online world, like how do tools like, I'd say, right, social media, blogs, podcasts, how do they help your practice educate and engage with your patients?
They're not. They're not, mainly because I'm running a smaller practice at the moment.
Right.
And nothing to do with the podcast kind of here, but I intentionally homeschool my kids. So my wife's W-2 employee.
Yeah.
And so if I didn't have my wife as a W-2 employee, I could afford to hire more people.
Right.
And build bigger, but we chose not to.
Right. Well, family first, right?
And,
Yeah.
It is right now, right? It is when my kids are really young.
Yeah.
And as they continue to get older and go do their own thing, well, then we can refocus our energy. But for the time being, I wish I had more energy and time to do stuff like this, but it's just not feasible at the moment.
Do you have any strategies? Do you encourage patients to kind of share their experiences, like as far as, because you said, 50% of your kind of the foot traffic that you have is referrals. Do you encourage your patients to share their experience? Like, is there a tactic or an approach for that?
I mean, we did for a little while, and it went really well. And then just like, again, everything comes back to falling on me.
Mm,
I run the business entirely, the financials,
yeah,
the clinicals, I run everything. So
yeah,
it's more difficult.
to keep up with.
Yeah.
Yeah. Patient referrals are huge, and not just kind of in the specialty area. For any chiropractic practice, I think when somebody comes to you and says, "Hey, I just saw Doctor So and So, and they did this for me, and now I feel like this." Now they have a personal connection to that office. It's huge. It actually weighs way more. It's way heavier than any marketing that you could ever do because it's personal, right? Yeah, I think it's a big deal. All right, $1 million question for you. You ready for this one?
Let's go.
If you had a magic wand, this is a magic wand. This is we're gonna go to a place in your brain that you don't use often because you're very technical. You're very like, so now you have a magic wand. You ready for this? What's the one thing you would change to overcome the biggest pain point in growing your practice? We talked about this a little
Oh,
bit.
I got you.
Yeah, yeah. Go for it.
I got you. The biggest pain point in practice, in my worlds, probably in chiropractic as a whole,
Mm-hmm.
is the medical model setup.
Ooh.
The medical model setup is a for-profit business. So most people are required. We're all required to purchase insurance, right? I use a Christian share program, right? But we're all required to use insurance, and so everybody's thought process is I have to use insurance.
Mm-hmm.
And insurance for somebody like me isn't going to pay me.
Mm-hmm.
But our system is set up to mandate you to use your insurance or mandate you to buy.
Yeah.
So a lot of patients come in the office and they want the best care, but the best care out there may not be what your insurance company says you can use. It's a for-profit business.
Mm.
They don't want you to actually get the best care. They want to say you can get 20 visits.
Mm.
Well, 20 visits isn't maybe what you need. And so in my office, I don't take insurance because I'm going to do what's best for you, not what somebody that's never met you says you can do. Or met your daughter that says, no, she might not need that. Well, they're not the experts. I'm going to do what's best for you. And
Right.
so because of that, I don't take insurance, so we can do whatever's needed,
Yeah.
whatever's required.
Yeah.
So the medical model is one of the downfalls. Insurance is one of the downfalls, essentially, of my world. Is always, well, you don't take insurance. No, I don't, because I'm going to do what's best for you.
Okay. So no insurance model, and I learned that firsthand walking into your office. But so okay, you don't accept insurance. I understand that, but how do you communicate the value of your services to patients and then kind of ensure, we'll call it affordability, right, comparatively to whatever's happening at the moment, kind of through maybe payment options or, speak a little to that if you don't mind.
A great question as well. My background is I lived in Haiti for a while, right? You see some crazy stuff.
Sure.
I've never turned away a patient because of money,
Right.
ever.
Right.
It's not going to happen.
Yeah.
And so if you want care, we're going to find a way to make it happen.
Yeah.
Some of us are more blessed than others, right?
Yeah.
But it doesn't mean that we can't find ways to make things happen. We live in a world that is just full of opportunities. We live in a first world nation, right? Money is plentiful. Things are plentiful here in the United States, even though they're getting more restrictive now. There is ample opportunity to get care.
Mm.
We might have to be creative,
Mm-hmm.
right? Chiropractic is one of the last fields you can barter in.
Mm.
I've had people barter. Okay, we can do this.
Mm-hmm.
You're really good at X. Well, I'm really good at Y. Let's
Yeah.
just do this together.
Mm-hmm. That's awesome.
And so I'm not opposed to anything. I will not turn you away for care. I promise.
Love it. That's actually really cool. Barter. Okay. All right. So, keeping your business hat on, you're a one-man shop, really. You do everything yourself. If you could solve one business challenge with put a number in, $1 million, $10 million, whatever investment, what would it be and why?
Oh, hands down, numbers solve everything. Numbers solve everything. If we can invest into your marketing program, uh, numbers solve everything.
Sure,
Always.
sure.
As far as business goes, even if somebody has a bad experience and you bring in 3 more patients, okay, the numbers will solve it.
Mm. Winding down here a little bit.
That sounds really bad, but it's the truth.
It's the truth. It's the truth. We got to be honest, right?
You're talking about business, right?
Yeah.
However,
business cap.
patient satisfaction should be number one. Patient results, but numbers on a business side, numbers will solve everything.
Yeah, true. It's 100% true. Absolutely. So again, winding down a little bit, I want to talk a little bit about the future of chiropractic care. We kind of touched on it a little bit because of the research that you have going on currently. We won't get into the details. I'm not going to jeopardize anything for you, but where do you see clear scoliosis reduction in chiropractic in the next, we'll say 5 to 10 years? Are there any new services or maybe expansions in the works?
Gotcha. Great question. I got a couple different ideas with working with a couple other doctors, opening up some satellite locations. The clear program itself is very difficult to get into. It's a lot of education. The Clear Institute tests that I've taken are the hardest tests I've ever taken. I took 5 national board exams for chiropractic, 3 for nuclear medicine and CT. The Clear Institute exams are the hardest ones I've ever taken, by far.
Sure.
By far. And those other exams were tough, but by far it was the most difficult. So we're looking to possibly open up some satellite locations so that way people can get access to the Clear Institute still at other locations. Most people travel a long distance. You yourself travel 40 minutes to see me, right? We live in a city of 1 million plus people. Very easily we could open up in Fortville, South Carolina, and you travel here and still have access to all of that. The doctors are the biggest gateways to that because it is such a difficult program and it costs a lot of money and a lot of time to learn this.
Okay. All right. Cool. Satellites. I like it. I'll visit your first one in Fort Mill.
Let's do it.
Yeah. All right. So, okay, motivation. A lot of people have struggled with motivation, generally, right? But what keeps you inspired to continue really advancing scoliosis care and really transforming lives? What's the motivation behind it?
Yeah, some like Goggins stuff here. The anterior singular cortex, huh? This is my personality as a whole. I always want to be the best of the best.
Yeah.
And the best that was ever invented kind of thing.
Yeah.
That's just my style.
Yeah.
And so what makes it, because I know that we're just touching the tip of the iceberg. I know it. Even though we're getting great results, I know there's more.
Yeah.
There's more out there. So what is it? Well, I can always get better. Right? I am probably my worst enemy, hands down, in almost everything I do.
Wow. So your motivation comes from just wanting to be the best at everything you do, really, at the end of the day. And of course,
what's best for you, right?
Yeah, I was going to say
what's best for you.
Yeah.
I know what's best for you. I've done the training, I've done this. Here's everything I have.
Yeah. And not for nothing, I don't think just anybody can do what you do because you have to retain a lot of information.
That's what I hear.
A lot. Man, like you run circles around me when we have some of these conversations and I'm like, where does he keep it all? Like, does he have an extra SSD planted in the back of his brain that, like, it's insane to me how much information you have back there.
Great mentors.
Yeah.
Great mentors.
Well, don't discount your brain, man, because again, not all of us can do what you do. There's a lot of retention involved with the information that you are given, right? For me, I don't retain. I retain maybe 10% of a conversation, right? I probably have to listen to this podcast like 10 times before I, get it all in. So, that's all you, man. That's all you.
Sure makes it interesting at home sometimes. Well, it's like My personality. Have you taken the disc profile? Have you taken the disc profile?
No.
So disc, driver, intuitive. There's 4 different personalities, right? And I don't sit into when I'm in business. I'm a driver. I will run you over to excel. That's my personality in business.
Yeah.
At home, I'm a precisionist, which means part of the positive and negatives of that is you're almost always right. And so it's been interesting at home. You always have to be right. I'm like, because I am. Because I am. So far you've never said no.
I love it. It's kind of the opposite in my house, but we won't go there. All right, so for listeners, considering chiropractic care, but they're feeling hesitant, what would you say to encourage them to take the first step? And before you answer, there's a lot of people listening whose shoes I've been in that are hesitant because they're afraid, because of misconceptions. I used to think you can be paralyzed if you go to a chiropractor. So what would you say to someone like that? How would you encourage them?
Chiropractors are not all the same. Not even a chance.
Yeah.
If you're really looking for corrective care, which is the only care I recommend, it's the one that has science behind making long-term changes, physiological science. It changes your body chemically. It changes it physiologically. It functions better when you make the spine go back to where it should have been. The neurology functions, which implicates every other organ. Right? If you're only just doing regular adjustments, you feel good temporarily. It's completely natural. This is what chiropractors will tell you. Well, cocaine's natural. It doesn't mean it's good for you, right? Yeah. So you're looking for a corrective care doctor, which means they have extra studies. There's no way a corrective care doctor that has consistent before and after films, right? So you can say I'm a corrective care doctor, which if you go on almost every chiropractor's website, they'll say they are. We'll ask them for their last 10 patients' films. Right? Let me see how you've done this. And so you're going to be looking for somebody like a clear doctor, somebody like a chiropractic biophysics doctor, somebody with a Pedibond background.
A what?
Pedibond.
What is Pedibond?
It's an older technique, but it was a corrective care technique. Okay. We use some of it in the office. Okay. So you're looking for these doctors that have went above and beyond. Yeah. Not just say, hey, I do corrective care. I know these doctors have the training to do it. So when I refer you guys down to Dr. Juan down here, nope, he's had the training. I know he's been through the training. Like, he's responsible for his training. I know he's going to do you well.
Right. Okay. So how can listeners learn more about Clear Life Scoliosis Reduction and chiropractic, or book an appointment with you? And what are the ways they can do it? Is it only in person? Like, if you can kind of just let them know how they can get in touch with you.
I'm a pretty easygoing guy. If you text the business number, it comes to the staff as well as it comes to me. If it's scoliosis specific, then I'm probably going to answer it 99% of the time. Okay. Right. It's super important that my patients that are in this niche get the experts to talk to. Okay. I don't want an assistant, a nurse, somebody talking to you. It needs to be addressed by the expert. So some of the clear doctors don't have that. That's how I prefer to do things. I'm a very hands-on doctor, as you're aware. Yeah. I want to be working with you. Yes, while I have other people in the office, I want to be doing the majority of everything to make sure it's good. So you can very easily reach out to the office via phone number. If it's scoliosis related, I'll be calling you back or getting back with you. You can reach out via email, office@clearlifescoliosis.com. You can book an appointment, which we do virtual appointments or in-person appointments. We have x-rays and imaging. It's a lot easier to do virtuals versus 34 vertebra, unlimited cases. Yeah. And so, that's essentially how people reach out to me. Yeah. Okay. So for your knowledge, if you're watching this, the way I reached out to him was after finding his site, I booked an appointment online. We ended up getting on a Zoom call,
talked about the situation, and then from there you advise that we, come in and, dig a little deeper, get some images done and whatnot. So that's
So
kind of
generally,
where we're at.
our first consult is generally, again, I'd say, here are your options. Here's what I see. Now, whether you come to care with me or not, that's up to you guys.
Sure.
And this goes with every patient, not just you.
Mhm. Yeah.
We went through this twice. And say, here's what we see. Here's what's going on.
Yeah.
You can come do care. You can wait it out like a medical doctor. You can
Yeah.
try PT. But here's what's actually happened and give you an informed consent.
Okay, great. All right, I'm gonna now kind of leave you or leave them with this $1,000,000 question for you. What is the single most impactful investment, financial or otherwise, you've made in your journey to becoming a leader in scoliosis care? It's a big one.
Hands down, studying with Dr. Wogan. He was the founder of Clear. He's a wonderful man. When I went up there the first day I met him, he gave me a thumb drive. I came back on day 2. He was like, "So did you get through all that?" It was his life's work.
Wow.
He said, "Here you go." Could have charged tens of thousands of dollars.
Oh, easily.
But
Wow.
these are what most clear doctors are. They are there for you.
Wow.
And so he's like, here. If we wanted to reach out to him, he was always there. Obviously, as you're aware, I worked in missions. I've been back to Haiti multiple times. And he's, so is he. He's like, well, here's what I did. Kind of helped me guide through what he did there. My last trip to Haiti was more of a mission trip for the doctors that I went with than anything. God kept me there while I was supposed to be going home. But he was hands down, the Clear Institute's had the biggest influence on everything,
Right.
almost everything that I did. My practice is the foundation is on his teachings.
That's huge. It's amazing how much of an impact a person can have. And now that you're doing this, you'll have an impact, and it's really that ripple effect, right? And whoever came before him, etc., etc. So that's really cool. Great answer, man. Really. Dr. Justin, thank you so much for your time. Really appreciate you coming out.
Well, thank you.
Thank you.